the 12 pairs of cranial nerves. We're going to take a look at them on this page, and I'm going to give you a couple mnemonic devices to help memorize them. Okay, so you're going to need a blue highlighter for the sensory ones, a pink highlighter for the motor ones, and an orange highlighter for the nerves that are both sensory and motor. So we'll start off with cranial nerve number 1, which is purely sensory. And can you tell from its location what it might do for us if it's purely sensory? It must be one of your 5 senses. Sure enough, it is cranial nerve number 1, olfactory. Purely sensory. And then we'll use a green pen to list the function. Not surprisingly, olfactory gives you your sense of smell. And then we'll use a purple pen for the holes in the skull that it passes through. Now, actually take your blue pen again. The olfactory bulb has these hair-like fibers that come off of it and go through holes in the cribriform plate in the ethmoid bone called the olfactory foramina in the cribriform plate of the ethmoid bone. If someone gets in a car accident or just gets smashed in the nose, then or the front of the face, they can actually crush these holes and lose their sense of smell. Okay, now the second cranial nerve is also purely sensory. So we're going to put that one in blue too. So the first two are sensory. Number 2, this is your sense of vision. So write number 2, optic, and then use your green pen. This is your, gives you your sense of sight, so it's another special sense. And then use your purple pen to put the hole that it goes through in your skull, which in this case is the optic canal at the back of your eye socket. Okay, then the third one is purely motor, so you're going to use your pink highlighter. This is the oculomotor cranial nerve, and it is one of the easier ones to find on the brain stem of the sheep, which is kind of nice. So use, how about a red pen for these purely motor ones? So the oculomotor is purely motor, but it's not just somatic motor, it's also autonomic motor. You might remember that because, let's think about this. So the use your green pen. The somatic functions are moving 4 of the eye muscles so that you can move your eyeball. And this would be considered somatic. And then autonomic, and specifically parasympathetic fibers, control the ciliary body. Oops, how about we just say contract the ciliary body? And that will bend the lens for close vision. and constrict the pupil to protect from too much light coming in. So if there's some sort of trauma to the brain where this nerve could be pressed on and the doctor shines the light on the person's pupil and it doesn't constrict rapidly or vigorously, or maybe does in one eye but not the other, that's a very dangerous sign of brain damage that may have occurred somewhere in the brainstem, and specifically pressing on the oculomotor nerve. And now get your purple pen. The oculomotor nerve passes out of the back of the eye socket, just like the optic nerve, but it goes through a different hole called the superior orbital fissure. A fissure is a long, narrow hole. It looks like this at the back of the eyeball, at the back of the eye socket, and then the optic canal is right next to it. So we're talking about the fissure here, and in this case the optic canal is right next to the fissure. Okay, so sensory, sensory, motor, and the next one is motor 2. Of course, then this is number 4, the trochlear. You might even remember that this is attaching to the bone of the face through that trochlear notch, controls an eyeball muscle called the superior oblique. And so let's write that function in green. It's a somatic muscle. So far, with the you could say, what nerves control your eye muscles? You would say oculomotor and trochlear. And then this passes also through the superior orbital fissure. That fissure is pretty big, so it can fit several nerves. So it goes sensory, sensory, motor, motor, and then the next one is both sensory and motor, the trigeminal. You can color that in orange. See, it's a big one, huh? So find your orange pen. We're going to put the trigeminal over here so we have plenty of room, because it does have 3 important jobs. So you see tri in the name, and gemina, which means the 3 twins, or basically like triplets, right? It's got 3 branches. And it has sensory and motor functions. So first, let's look at the branches. The first one is called 5-1, because it's the first branch, and it's named the ophthalmic. You can probably guess then it's going to go to the eye, right? And sure enough, if you were to look at the face, put some ears on there, some eyes, the ophthalmic is responsible for feeling on the face from the eyes up. and also motor to the lacrimal gland. So autonomic, parasympathetic, to the lacrimal gland to make more tears. Okay, so that's branch number 1. Then 5-2 is called the maxillary. Also corresponds to the part of the face that it helps you have sense of feeling on. So again, if you were going to draw a face, put some eyes on there and some ears. And let's say this is the mouth. Then from here to the eyes, this gives you your sense of feeling. And then the third branch is called V3 or 5-3. And that one is called the mandibular. That's the mouth. So on the lower jaw. And upper teeth here. So you can thank the maxillary and the mandibular branches for your sense of feeling not only on the skin of your face here, but also your teeth. And if you have to have any kind of mouth work done, then they will numb one of these branches. Then there's also somatic motor output. To the muscles of chewing, or we call those the mastication muscles. So there's a little bit of motor output both in the first branch and in the third branch of the trigeminal. And I'm not going to have you worry about the holes in the skull that the trigeminal nerve goes through. Okay, now let's look at number 6. And we're back to motor. So you're going to use your pink highlighter for the 6th cranial nerve. And then your red pen to label it. And it's the abducens. And controls the lateral rectus. So you can use your green pen. So it has somatic control to the lateral rectus. And you want to guess what hole it goes through? Just like those other ones, right? The superior orbital fissure. So use your purple pen for that. Okay, so what this means is that you have 3 cranial nerves that are dedicated to controlling your eye, the external eye muscles and the ciliary body. You have a 4th cranial nerve that's dedicated to your vision. So 4 cranial nerves that are key for controlling the eye. Then if you throw in powering up the lacrimal gland, then you even have more cranial nerve dedication to vision. So you can see how important it is to humans to be able to see well. Okay, now next we'll look at the 7th cranial nerve, which is the facial, and that is going to be orange because it is both sensory and motor. down here. So some sensory functions that it has. It contributes to taste. It's not alone though, the glossopharyngeal helps with that. And then it has motor output too. All of the expressions that you can make are powered up by the facial. And you can see if there's an infection or inflammation of this cranial nerve, someone can get what's called Bell's palsy, and one of the symptoms is that maybe half of their face would sag. And it's usually limited to one side or the other, and usually does go away and resolves itself. Bell's palsy is inflammation, which could be from irritation or infection, but inflammation of the facial nerve. Okay, and then it has some ANS, or autonomic nervous system, parasympathetic. Once you start to really have all this click into place, you won't be surprised that every time I tell you it's autonomic, it's parasympathetic with the cranial nerve. Because remember, it's also called the craniosacral division. The sympathetic fibers, the ones that would turn off the lacrimal gland, turn off the salivary glands, and dilate the pupil, etc., those are coming from the thorax. They're coming off of the spinal cord, and then they come up through the neck. But if you want to cause more saliva to be produced, or more tears to be produced, or have the ciliary body constrict the pupil, then we're talking parasympathetic functions, because another name for the parasympathetic division is also rest and digest, and you need saliva for digesting, and you need tears for resting and repairing the eyes. Okay, now use your purple pen for the hole. This goes through a hole in the skull called the stylomastoid foramen. The mastoid refers to the mastoid process, which is that big bump you can feel behind your ear. There's a hole right in front of it that the facial nerve can come out of and then go along your jawline and then spread out to the other muscles. Okay, next up is cranial nerve number 8, and it is purely sensory for your ears. So let's go ahead and color it blue. It takes information from your inner ear about both hearing and balance. So it's another special sense, hearing. So now, if you look at what we've got here, up to the top, sense of smell, sense of sight, sense of hearing, a little bit of sense of taste. We'll come back to that with the glossopharyngeal on the next one. And then sense of touch. So you've got everything on these cranial nerves, all of your 5 senses. And then you can use purple. Oh, I guess I didn't give you the hole that it goes through. That's okay. I won't ask you that. Okay, then the glossopharyngeal is going to be orange, because it's both sensory and motor. So 9, it's written like this in Roman numerals. Glossopharyngeal. Glosso means tongue, and pharynx is the back of the throat. So it's going to be having its effect near the back of the throat. It has, so use your green pen for its functions. Okay, so I can underline this too. Sensory, some taste, and then it has somatic motor for swallowing muscles. And then pink for the hole it goes, or sorry, purple for the hole it goes through, the jugular foramen.